It was after another mass murder in Colorado, the 2012 Aurora Theater shooting, that Governor John Hickenlooper announced a plan to expand Colorado's mental health care system by establishing crisis services, including a statewide hotline, 11 walk-in clinics that are open 24/7, and mobile crisis response teams. These new services have been up and running since December 2014, about a year and a quarter now, operated by 4 mental health contractors for the State Department of Human Services. Dr. Carl Clark is on the board of one of those vendors, Community Crisis Connection. He's also CEO of the Mental Health Center of Denver. And also with us, Dr. Liza Tupa, who is with the Colorado Department of Human Services as Division Director of Community Behavioral Health, which oversees the crisis services. And let's talk first about the impact in this first year. How many people have availed themselves of these services?
So in about the first year that the system has been in existence, 115,000 calls were placed to the statewide hotline. About 23,000 individuals have visited a walk-in center and a crisis stabilization unit, and mobile response has responded to individuals in their homes or places of work or schools a little over 13,000 times this year.
Did you expect that kind of response? Is that larger or smaller than you expected?
I'd say it's pretty close to what we expected and certainly what we'd hoped. I would say that it's a little higher for the first year than what we might have projected, but that's a very positive thing, and the fact that the system has been able to respond that way is very positive.
Dr. Clark, give us an example of a type of contact that might be made one way or another, whether at the hotline or someone walking into one of the clinics.
Well, what we want people to know is you don't necessarily have to have something wrong that's happening, but if you're just worried about something and need somebody to talk to, you can make a call. Because all of us have things that happen in our lives. And we often see after a crisis has occurred of some sort, where we have a conversation with friends and family or coworkers, where people are saying, you know, I thought something was going on, but I just didn't know what to do about it. That's what this is all about. Even if you just say to a friend, it's like, God, something seems to happen. Why don't you give the crisis line a call? And it's professional staff that can sort through what's going on and give you good guidance.
Does it also get more to be more of a crisis? Do you also talk to people who are really much more upset than that?
Yes, we see the full range. So, for example, at our walk-in clinic, which is on Colfax, which is a busy avenue, about 45% of the people that walk in there are actually thinking about suicide. So that is definitely a crisis in somebody's life if they've come to that point.
Liza, how many of these people do you think have never interfaced with any kind of mental health care? Are you reaching people who wouldn't have thought to try and get help before?
Yeah, I think that we really are with this system. Similar to what Dr. Clark mentioned, the callers to the statewide hotline, the majority of callers are calling about some sort of anxiety or worry or a family issue. And many of these individuals have not had prior mental health or substance abuse treatment, what we think about really as treatment. So the system really is for anyone who has a concern along those lines. They can call and as Dr. Clark said, just talk to someone, a sympathetic ear, someone who knows about different services throughout the state, and get some information about where to turn next if they need to.
That was going to be my next question, Carl. What about follow-up treatment for people? Like, how often is something resolved in just one visit or one call to the hotline, and how often does there need to be more?
Well, about 20% of the calls are something that can be handled over the phone. You know, somebody's in some sort of situation, they need to have somebody to help them think through what's going on and make a plan around that. So that's 20%. So that means then 8 out of 10 people, it's something more than that. And during that sort of telephone conversation, it can go anywhere from, well, there's a walk-in clinic nearby that you could go to, or it might be, sounds like you might need sort of more intense help. and perhaps one of the crisis stabilization units where somebody might stay overnight or maybe longer. Or at times they send out mobile crisis teams where it's like, stay right where you are, we're sending somebody out to help you.
What you referred to there, where somebody can get away from their own home or family situation, that's called Respite. That's something new, is it?
Well, there are two types, so the crisis stabilization, usually somebody is having some sort of behavioral health issue that is serious enough that you need the kind of medical help wrapped around them. The respite beds are more for people need to get out of a situation that they're in. It could be something going on at home or a school environment or whatever it might be, but they need a break from their current environment and they can stay there.
We heard earlier in the program from Sue Klebold, who has written a book about how she didn't know what was happening with her teenager. It seems unlikely to me that someone who is about to be violent would call the crisis line. Do you also hear from people who may be concerned about someone like that?
Very much so. And when we designed our marketing and messaging program to roll out the statewide crisis response system, we specifically targeted our messaging not just to individuals who might feel that they need some help, but for anyone who is concerned about someone. So one of our taglines kind of is, if you or someone you know is experiencing a crisis, call the hotline. So it really is for anyone to just pick up the phone and say, there's my neighbor, I'm a little worried. Do you have any thoughts? Do you have any suggestions about what I could do? We absolutely encourage those types of phone calls.
All right, so all of this has expanded the state's system of mental health care. When you step back and look at the overall system of health care, is it adequate for what Coloradans need?
Well, gosh, I think it's a bit stretched with the introduction of the Affordable Care Act and many more people now being eligible for Medicaid services. I would say that it's been a challenge to meet all of those needs. Overall, I think the system has risen to that challenge, but certainly it's been just that, a challenge.
Thank you.
I might add that we have a maldistribution of health care. So if you live in a metro area, there are a lot of providers that are available to people, but Colorado is predominantly rural. And so, for example, the San Luis Valley is the size of Connecticut. And to get access to services in a place like that is just more challenging. People have to drive farther distances, and the volume of people coming through makes it a little more difficult to set up a robust system. A system is there, but it's just more difficult to make that work.
Thank you very much, Dr. Carl Clark and Dr. Liza Tupa.